Hi, this is Dr. Jason Tripp. Today we're talking about neuropathy. Now, if you're suffering with neuropathy symptoms, which is buzzing, burning, tingling, feel like ants crawling on you, or you're always cold or always hot, usually it's in your hands or your feet, then this video is for you. We're going to talk about neuropathy and what could possibly be done. If you do and you're saying, hey, yes, I have some type of numbing or tingling in the hands or fingers, I want you to put in the comment section below and say, yes, that's me. If you're just watching it for information or watching it from someone else, put in a no so I know who I'm talking to. And let me go ahead and tell you some things. Now, neuropathy, again, is a problem in the nerves. It happens when there's a decrease in the amount of blood that is surrounding the nerve. So that nerve should have a full blood supply. If the nerve has full blood supply, it heals rapidly. But if the blood supply is diminished in that blood vascular bed, either in the feet or the hands, then your body will not heal the nerve as fast. When that's happening, that creates more problems, and the longer it's there, the nerve can actually start to die off. Now, when it starts to die off, that's when you get that numbing, that tingling, the feeling of being cold all the time. Or you can go outside barefoot in the snow and never even realize it. Like, all of those are some really bad symptoms. I actually had a guy, he said he goes out in the snow regularly, barefoot, because he can't feel it. And I'm thinking, oh my gosh, like, this guy needs to not be doing that. Obviously, the wrong approach to health. He's going to lose his feet if he keeps that up. So you don't want to do that. What you want to do when you have neuropathy is find out exactly how far along it is. There's a neuropathy severity pain exam that can be done to find out how bad the neuropathy symptoms are. I've had people come in, they just barely felt any problems or any symptoms, and they end up having one of the most severe cases of neuropathy that I've seen. I've had other people that were complaining and, oh my gosh, everything's so bad, and they end up having like a mild. And so you can't go by necessarily what you feel. You go by all 9 factors that are involved in the neuropathy severity exam. And based on that severity, if you're beyond 85%, really it's too late to do much for that one. You want to find out so that you know, okay, I've just got to learn to live with this. Maybe there's some coping techniques that you can learn, or a medication that might be able to just bring down some of the symptoms while you're just trying to cope with it. But if it's less than that 85%, there's still hope that you can be helped. In most cases, if it's less than 85%, we can reverse the symptoms, or either all the way or most of the way out of there. If we can get 50, 60, 80, or even 100% change in someone who has neuropathy, that usually changes their life. So I'm going to encourage you to, if you have any numbness, burning, or tingling, don't wait, don't put it off, don't think it'll go away. Basically, how it works is, if you have neuropathy, it starts out with little burning, little tingling. It goes to worse, 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 and eventually leads to amputations. You've heard about this before. This is not the first time, but that's the road. That's the ending of that road. Do not think to yourself, oh, it'll never happen to me. Every person who had an amputation thought the same thing. So we want to make sure that you know exactly how bad that neuropathy is. Do the neuropathy severity exam. You can come down to my office, Dr. Jason Tripp, call the office 724-342-2225, and just call in and say, hey, I want the neuropathy severity exam. I want to find out how bad my feet are, and talk to them. They'll give you some information. You can come down and we'll just talk, see if there's anything that can be done. I'll let you know. If there's nothing that can be done, like that gentleman who was walking out in the cold and really wasn't able to do anything, or feel his feet rather, obviously it was too late for him. He has to just suffer with that forever. But again, that was a person who put this off. Don't be a person who puts it off. Be the person who says, you know what, I'm bad enough. I'm drawing the line. No more. I'm going to stop and go get this checked to make sure if it can be helped. Most cases can be, but I don't want to have you just think, oh, I'm good, and then get worse to the point that it's too late. So we do the neuropathy severity exam here at the office. Call the office, again, 724-342-2225, and schedule time to talk to me.